Hello, everyone. Let's welcome Dr. Monalisa, who has secured a seat in DNB SS in gynecologic oncology at Apollo Hospital in Bangalore through NEET SS. Many congratulations, Dr. Monalisa. This small interview is for us to discuss with you your story, your background, and then what was your strategy to prepare for the NEET SS exam to clear it and to get a seat that you wanted. So
Yes.
over to you, Dr. Monalisa. Many congratulations on the result. Tell me about yourself, doctor.
Thank you so much, ma'am. Ma'am, I finished my MS in 2016. And then in 2017, I wrote my DNB theory and practicals. And then 2017 was the first time I came across this NEET SS, the year it was introduced.
Yes,
So
that was
that paper I had written first. And then again, I sat for the paper in 2020.
okay.
And
So
then
2017, 16, 17, you were very active. You took 3 exams, the exit exam, DNB SS you cleared, and then 2017 NEET SS also.
yes, ma'am.
But then your result wasn't good, so you took this gap of 3 years.
3 to 4 years, ma'am. I didn't study anything for personal reasons. There was a gap.
All right.
And
All
then
right.
2020, I decided that let me know the
But the hope, the dream was still there in your head for 3 years, and 3 years later you came back to appearing for
yes,
NEET SS again.
came back. Yes, it was always there in my head, in my
Okay.
subconscious mind. Just that my personal circumstances didn't favor me to study, and so I never sat for the exam. But I was aware that exam is going on. So
And I,
2020, I just thought that let me sit for the exam, and then it was a different paper than 2007.
let's first listen from you where you have done your UG and PG from. Did you tell us that?
No, ma'am. I did my UG from MKCG Medical College, Orissa.
Okay.
And then my post graduation is from SCB Medical College, Orissa, ma'am, Cuttack, Orissa.
Okay. You're from Odisha.
Yes, ma'am. I'm from Orissa, ma'am. And then
Okay.
I got married in 2015 and 16. I moved to Bangalore because my in-laws' place is in Bangalore, and I was working in St. Philomena's Hospital, Bangalore, as a DNB
Okay.
faculty.
So this seat is very good for you that you're already in Bangalore and you'll be continuing in Bangalore only. So
Yes, ma'am.
congratulations on bagging a seat in your own city.
Thank you, ma'am.
Right.
That was the blessing in disguise, actually. The last thing was safe for me.
Right.
Yeah.
So what happened in 2020? You took the exam again.
2020
The
was a
pattern by now had changed.
yes,
2017
ma'am.
it was basic, and then 2020 it was gynecology oncology.
Yes, ma'am. It was entirely different. Then through my seniors, I came to know that you are offering help through platform. So I subscribed to your app, and then I started following it. But I was not able to religiously follow your video lectures because schedule is busy, ma'am. So, but I used to go back and recorded lectures and the notes I used to study. But I couldn't do justice till June 2021. I was not so much
Okay.
into study because of
Okay.
the COVID and all. Then June 2021 was the time when I started to study, like seriously, I started to study. Apart from your notes and your videos, I went through Berek Hacker, NCC, and FIGO because it was a onco paper. And so my mind also was into onco, and I tried to grab everything which was available for the onco thing. But reproductive I only did the minimum, whatever even what you had taught also I didn't have time to entirely cover it. It was very superficial. ये तो नहीं आएगा, ये तो नहीं आएगा, नहीं है, छोटा छोटा चीजें, हाँ मतलब whatever is needed I ignored
That
and I
much you
went
did.
off. Then 2021 was a game changer paper again. It was,
Again, it had changed.
yeah, and only that onco thing, reproductive thing came.
Okay. So you had
So
prepared for onco, but it was a
exactly,
mainly a
only
reproductive medicine paper.
yes, I came back and saw everything was in your notes, which I had not touched
Regretted
upon.
not having read.
Yeah, regretted not having read properly. It was very super because it was very, very onco paper. So my mind was also for the onco thing.
Yes,
And
and even I believed in 2022, we were all surprised that
yes,
last
ma'am.
2 years it was onco reproductive medicine. This year also it'll be something like that, but this year again it had changed.
And then, like in 2020, I had not qualified for the exam, but 2021, I managed to get a rank of 139. So I was like, I was told that, okay, one last try. So then I started reading your reproductive part first. I tried to had a you grip over that first. In the meanwhile, I wrote the Zipmer paper also. Zipmer April, it was there 2022. I got a rank of 3, missed by 2 marks, ma'am.
Okay. So
The
Isha had
doctors,
rank 1
yes,
and
yes,
you had rank 3 just by
yes,
2 marks. And it
yes.
was a good paper, she told me.
It was a good paper, ma'am. Every if matlab, the onco and the obs gynae part was too much from your app, but then they asked about studies and all also.
Which I had not included.
Yeah, that I also had, matlab, I had made notes of, but somehow those things were not revised properly. Because
Yes.
if not, they took out the exam schedule in a very short notice. Usually they give notice well before. This year, that year they delayed also, and they gave it a very short notice of maybe around 20 days.
Okay.
So yeah, so I failed to touch upon those parts.
But that's
That was
only for JIPPER exams and INI SSCT, I believe
yes,
that you
yes.
need to do those
Only that, ma'am.
trials.
Only
Yes,
that.
otherwise for NEET SS,
No, it is
it's
not
not
needed.
important.
It
It
is
will
not
take a
needed.
lot of your time and there would be many questions on that.
Those trials and all. Yes, ma'am.
Yes.
And then I wrote this NEET, and it was again a
Game changer.
surprise in the exam that nothing is there, neither onco nor
Nothing
reproductive.
from onco, nothing from reproductive medicine. It was all basic OBG.
Only my MS knowledge and whatever
Yes.
I study, teach these kids at DNB, only that came to my head. And that is how I managed to get a rank of 106. I never expected that I'll get a seat even, because everything was over in the second counseling. It was over at 97. But then the mop-up round, only one seat came, and
then you got a seat in
I got
Bangalore.
the seat. Yes, ma'am.
Congratulations on that. Tell us about your more about your strategy. What were your sources of reading? What all you read
Ma'am, I had
just before the exam?
no, I had very less time to prepare, and what all I did, what is I chose that I should follow only one thing, because I do not have time for referring things, like going back to the
Most of the
guidelines.
students don't have time to go back to textbooks.
I can't even. You used to always tell that my lecture is complete, but your study will be complete only if you finish the MCQ part and finish the guideline once. But I never had that much
You
time,
never
ma'am.
had that time.
I only could listen to your videos, and I didn't have time even to make notes.
That is
So
what I wanted to ask. Did you make your own handwritten notes like the other students?
it's difficult for me with a kid around who will scribble my notebook. I was not able to. So I used to just sit
Okay.
and memorize and listen to your videos.
So this
So
is an important information for students that even without making your notes, you can manage with the videos and the notes which are already
repeatedly
there.
seeing those things, repeatedly seeing those things, listening to those things.
First,
Yes,
go through the video lectures and then read the notes.
that is very important, ma'am. Without listening to the videos, you can't directly jump to the notes, because there is
Yes.
no connect. There is no connect, because a lot of things you have told. You have told that,
Yes.
see, this thing will come after this thing, and this is how the basis of writing this thing is this. So if you
This
haven't
because
listened,
memorizing without listening to the video
no,
lectures is
it is
very
difficult.
difficult.
Yes. And once your videos are done, then it becomes very easy to go through the notes. It's just like something went into your brain, and once you see, the visual impact is done. That's all.
Yes.
And for pictorial things also, you have told clearly that, see, this might come in the exam. So then, if you have listened to that once, then
Then it is
yeah, then
easier
it
to
comes.
recollect.
Yes, yes, ma'am. So listening to your videos is more important. If not live, let it be the recorded ones at least.
Yes,
That has
live is difficult for many students because they're all busy.
helped, ma'am. Because
Yes.
we are working, we are
Yes.
driving, we are
And even
cooking.
I cannot stick to a fixed schedule. I also change the timing of live classes very much.
Exactly. Night 8 o'clock, it becomes difficult, because that is the time when my child will have dinner. I have to put him to bed.
Yes, yes, and then
So
you have
that
to
is
find
very
your own
difficult
time.
time. So recorded videos are very comfortable for me, and that is
Yes.
what I did, ma'am. I didn't have much time for referring to
Just
books.
1 minute. Just give me 1 minute. I will pause. Yes. So what were you telling me, Dr. Mona Lisa?
About your videos and your notes, ma'am.
Yes.
So that is what I was sticking to. Guidelines, some which you had put in everything which you had put as a reference,
Yes.
that I went through the recent
Through the
guidelines. just for the sake of completion. But and the confusing topics like endometriosis, PCOD, which keeps changing, that much of thinking business I never did, because you are the one who is practicing that. So you would have told that this was there, this was there, and now it is. I used to only
Endometriosis was one such topic where it changes every year. Almost
and
every
even
year they bring
PCOS,
up something new.
even
PCO
PCOS,
also.
so much of discussion,
Everything
debate happening.
changes. 2 years ago, the drug of choice was something else. Now it is something else.
Now it is something else.
The
So all
definitions have also changed.
change,
12
yes,
follicles or 20 follicles.
yes. And in which case it is told, all that you've
Yes,
clearly
which
told,
case it is 12, which
with the
case it is 20.
8 hertz
And they ask direct
tone.
questions on those only. There were so many times, 20 follicles or 10 ml.
Yes,
What
ma'am.
is PCOS?
Yes. So FET, this reproductive and obs-gynae, you have covered thoroughly. It's
Yes.
more than enough. It's more than enough, ma'am. And that is what they're asking every year.
They're asking the same predictable
The same
questions are there in
questions.
FET. Not same questions, but from similar topics.
Just a twist of the
Yes, a little
choices.
twist, but the same topic.
But basically
But
from
NEET
this,
SS is not like that. For the last 4 or 5 years,
it is
NEET
just
SS always has been unpredictable.
yes. So that's what I'm telling the people who are preparing, like my juniors and all. Like have a like interest oriented exam. Take always interested. If you're interested in reproductive, write reproductive exam only. Why do you want to go through, NEET and studying the unpredictable pattern? And that is what I keep. Yeah, that is different. That it is offering fellowship, and NEET is offering DMMCH. But then this is the con of NEET, that the pattern is not
Pattern is unpredictable.
forever changing. It's forever changing.
Yes, it's changing. But still, people who have read do manage to get
Yeah,
good ranks and a seat.
Yes, ma'am. Yes, ma'am.
Even if the paper is predictable, everyone is sailing in the same boat, and those who have read well do have a good fair chance to get good ranks. It's that people who have not read also stand good chance, because the paper sometimes is so easy that everyone is able to mark. When the paper is easy, the competition is more tougher.
More tougher, ma'am. More tough.
Yes,
This time also, everyone thought that paper is easy, but it wasn't easy. It was a tricky paper.
It was a tricky paper.
Like every question came down to ruling out those two options and then getting stuck in those two options. So that is what it happened. It's just that you have to be very strong in your basics and follow what you have
nowadays
offered.
for NEET SS, it is basics that you have to know.
Basics. Yes, ma'am. Yes, ma'am. That is mandatory. You have also started covering in your classes now.
I've started to cover Williams obstetrics now.
Yes,
the parts which we left because we thought NEET SS is a difficult paper. And this year it was all basics. So we've started
all basics. And difficult basics it had asked, ma'am. It was not the easy
difficult
basics.
It was not simple questions. It was difficult.
Like the physiology of labor part also, very molecular level, those questions taking of contractility and all that. Direct lines they've picked up from this 25th edition of Williams, ma'am. From first page to last page. They have picked up. Yes.
Many questions.
Many questions.
Directly from Williams.
Direct questions.
So tell me your strategy in the exam. Was there any planning before that, how many you're going to mark, or it was just decided during the exam? And how many did you actually mark?
I left only 4 questions, ma'am.
Okay.
Because as I was facing the paper, I thought that if I'm leaving many questions, I have to be very confident about the questions which I've attended. Because if I leave more, then I'm going to be at the losing side. So only the 4 questions which I had no idea about, I left. Other things I marked, ma'am.
This is what students are following. If you don't have any idea about a question, you leave it. And if you can, come down to 2 options, then you have to mark it.
We cannot take the chance of losing many questions. Yes, ma'am.
Even if you're not very confident, if you know the question, you should mark it. If you have read about it somewhere, it's more likely that it is more likely that you will mark a correct option than you will mark an incorrect option. So you should mark.
Yes.
Wonderful. So the next NEET SS exam is going to be in the next 4 to 6 months. Any tip that you would want to give to the students?
The people who are doing their post-graduation, they have to stick to their basics and follow your notes and videos, ma'am, because that will be, making them revise easily without going back to the textbooks again and again. And people like me who are working, I think they should work, ma'am. The last 1 month.
Working is important. Don't take leave from now.
No.
Because nowadays the questions are going to be clinical. You never know which patient is teaching you what.
Exactly, ma'am. And you tend to remember more when you're doing work.
Practical knowledge.
You're applying the same thing. Whatever you are teaching and whatever you have read, you are applying it, you are updating yourself.
Yes,
That
even I am applying whatever I'm teaching, I'm applying that in my practice.
yes,
So
I've
it'll
heard
help students also.
saying that many number of times that these classes are helping me to better
Yes,
clinic.
actually, it is helping me to, have confidence in my practice. I can tell the patients confidently that this is the percentage of this operation
Yes,
giving this complication. That
yes,
actually those percentages, no, during MBBS times, we would think that why we have to mark so many percentages, but
so
they are
much.
important in counseling.
Very, very important, ma'am. Now
Yeah.
counseling has become very important in our
Counseling is very important. Patients are educated. They are all at least Google educated. So you
ma'am.
have to tell them, explain them in proper words. So reading
Yes.
helps you in your clinical practice also.
But your notes and your videos are just the Bible for any preparing candidate like me, ma'am, who has no time and only can follow and rely on that.
Most of the students don't have time. And now that there are only 4-6
Exactly,
months,
ma'am. All are working now. All are
yes,
working.
everyone is working. And I would advise that you have to continue working.
Yes, ma'am.
After MS, leaving your job and sitting for 4 months is, it's
And
kind
the
of a
frustration
profession.
starts building because the
Frustration,
dates
yes.
are very vaguely announced. Somehow
Yes.
they're announced, and then even that doesn't happen properly. Your studying is also not happening properly because of the waiting process. Some way
Yes,
you
the
frustrate
waiting can be for a year or more
a
sometimes.
year or more. Like the 21 got postponed,
Yes,
and
to
1 year was,
22.
yes, to 22. It
So
moved
you
to,
cannot sit. Just when the dates are announced, then you can decide how many days leave you are taking.
and they announced the dates on within a 20 days. They announced the dates,
Yes, that
which
is
was not
also there.
one actually. They should have given
Suddenly it will come and then you
suddenly.
have to be ready
Thing.
for the exam.
Yes, ma'am.
Right.
So that is what.
Wonderful, Dr. Monalisa. It was so nice to have you over for the interview. We'll definitely stay in touch.
Yes, ma'am. Thank you so much, ma'am. The result is because of you. That's all. You are the
Thank you so
reason I'm
much.
here, ma'am. That's all.
I am the reason I've just helped you. It was all your hard work with your family, with the stresses that you have been through.
Yes,
So
ma'am.
you should be proud of yourself for this.
A bit, ma'am.
Of course, you should be proud of yourself. And then I was just a help to all those who are, who want to
You're the
prepare, who want to
bagpiper.
get the rank.
All the rats are running behind you now. You're the bagpiper for all the NEET SS aspirants, INI SS aspirants. You are the bagpiper, ma'am.
And that is
All
so
look
nice.
up